My name is Mary Susan Moss. I'm a clinical nurse educator in patient education. I work in clinical education and professional development, and I've been a nurse since 2013. My role as a clinical nurse educator is very different from the other nurse educators. I'm a health system employee, so I try to point people towards patient education resources that are approved, patient-friendly, and that are geared towards low health literacy, because the health literacy in North Carolina is fairly low. I was inspired to become a nurse by both of my grandmothers, who are nurses, as well as my mom. She's a nurse, and my sister is now a nurse practitioner. For some reason, I resisted a nursing career for a long time. I became an English teacher first and taught English and Spanish to high school students, but I knew I wanted more, and I joined the Peace Corps to dabble in healthcare projects and said, this is what I want. So I've been a nurse at Duke since 2013 and have not looked back since. As a Duke nurse, I lead with compassion by thinking about my own experiences as a patient. I was inspired by my own negative experience and how I felt, how anxious and scared I was, to make sure that patients I dealt with and clinicians I work with help their patients not to feel that way. If we are having a conversation with a patient and just finding out how they're feeling, making sure we're explaining things well to them, using a little bit of humor when we can, that can go a long way in making them feel like they can trust us and that we really care about them. And it feels really good to know that my role is seen as important too. So Duke Health recognizes all the different roles and the ways that nurses can contribute to our organization and to our patients' well-being and health. You are making a difference, and it may be small, but you could be making an impact to lots of nurses and hopefully to all of their patients.